Today we will discuss about vitamin D. It is a fat soluble vitamin. It is a steroid containing steroid nucleus cyclopentanoferritovinactrin ring. Function like a hormone. So it is a fat soluble vitamin. The steroid nucleus is cyclopentanoferritovinactrin ring. Function like a hormone. There are two main forms of vitamin D. Diet occur in two forms. First one is ergocalciferol. Second one is cholecalciferol. This ergocalciferol is also known as vitamin D2, found in plant sources synthesis from ergosterol. Second one is cholecalciferol. It is also known as vitamin D3, found in animal source. These are two forms of vitamin D. This calcitriol is active form of vitamin D synthesized from ergocalciferol. Ergocalciferol and cholecalciferol are sources for vitamin D activity and referred as provitamins. These two are main source for vitamin D activity, so referred as provitamins. Coming to synthesis of calcitriol or active form of vitamin D. The precursor for vitamin D synthesis is 7-dehydrocholesterol. Precursor for vitamin D synthesis is 7-dehydrocholesterol is formed as an intermediate. It is synthesized from cholesterol. Cholesterol biosynthesis 7-dehydroxycholesterol is formed as an intermediate. 7-dehydroxycholesterol which is presented in epidermis of skin on exposure to sunlight. 7-dehydrocholesterol is converted into cholecalciferol in the skin, dermis and epidermis. Is also known as provitamin. This is known as the cholecalciferol is known as vitamin D3, also known as provitamin. By the action of 25-hydroxylase, it is presented in liver, and this reaction required NADPH, cytochrome 450 and oxygen. It will converted into 25-hydroxy cholecalciferol or vitamin D3. This is the major circulatory and storage form of vitamin D. Then by the action of 1-alpha hydroxylase, it is presented in the kidney, converted into 1,25-dihydroxy cholecalciferol or vitamin D3. It is maintained calcium level in our body. This 1,25-dihydroxy vitamin D3, other name is called as calcitriol. So on that cholesterol biosynthesis 7-dehydroxycholesterol is formed. Okay, after that on the exposure of sunlight, the 7-hydroxycholesterol is converted into cholecalciferol. Then with the help of enzyme 25-hydroxylase, it is presented in the liver along with the NADPH and cytochrome 450 and oxygen. It will converted into cholecalciferol into 25-hydroxy cholecalciferol. This one is the major circulatory and storage form of vitamin D. Then with the help of 1-alpha hydroxylase, it is presented in the kidney. It will converted into 1,25-dihydroxy vitamin D3 or cholecalciferol. It is the active form of vitamin D. Other name of this one, calcitriol. So provitamin form ergocalciferol and cholecalciferol. Storage and transport form 25-hydroxycholecalciferol. Then active form is calcitriol. Next, coming to sources. Major on exposure to sunlight, followed by food sources, fish, egg yolk, fish liver oil. Moderate sources presented in milk. Okay, this one is the good source. Fish, egg yolk, fish liver oil. This one is the moderate source. Then RDA, recommended dietary allowance. 400 international unit in the case of children, 200 international unit for adult, 400 international unit for pregnancy and lactation period. Above age 60 means 600 international unit. Now coming to biochemical function. Important role of vitamin D is to regulate the level of calcium and phosphate in our body. Primary function, regulate that calcium level. Vitamin D is also known as hormones because it is synthesized or activated in the skin. It have action on target tissue, that is bone, intestine and kidney. It behave like a steroid hormones. Mechanism of action of vitamin D like group 1 hormone. There are 3 target tissue. First one is intestine, second kidney, third one is bone. First one is intestine. The brush border cell of intestine, vitamin D increases the production of calcium binding protein by acting through intracellular receptor. Means this vitamin D bind with vitamin D responsive element. It increases protein synthesis, that is synthesis of calcium binding protein. It increases calcium binding protein and increases intestinal absorption of calcium and phosphate. Second one is kidney. It acts on renal tubular cells. It increases the reabsorption of calcium and phosphate from renal tubules. Third one is bone. It is responsible for formation of bone and increases the mineralization of bone. So it helps for bone formation. These are the 3 target tissue on which vitamin D act and responds for increases calcium, serum calcium level. So these 3 target tissue responds for increases serum calcium level. What are the function? Increases calcium, it will regulate that calcium phosphate level. Second one is it acts as a hormone like steroid hormone. Then 3 target tissue, intestine, kidney and bone. Intestine, it increases this calcium binding protein. Second one increases that absorption of reabsorption of calcium and phosphate. Third one is increases the mineralization of bone, so formation of bone. Now coming to deficiency, it leads to rickets in children and osteomalacia in adult. Rickets, 2 years of age, the symptoms is craniotepis. 2 years of age means the symptom is called craniotepis. May soft and pliable skull bone due to that vitamin D deficiency. The corneodeficit, it causes soft and pliable skull bone. Then delayed closure of Bontanellis. Then frontal bossing due to soft and pliable skull bone. Then widening of wrist. Then when there is pressure on their leg, when the child walking, it causes bowed leg. Then rhesus rosary. Then Harrison's cycus. Then adult symptoms: soft bone, fracture, osteoporosis, and decreases calcium level. Along with the third one is renal rickets, deficiency manifestation, defective conversion of vitamin D. That means active form of vitamin D is absent. That is known as renal rickets. Active form of vitamin D absence means it causes renal rickets. Fourth one is hypophosphatemic rickets. Vitamin D resistant rickets, also known as hypophosphatemic rickets, disorder in which the bone become painful, soft and bent easily due to the low level of phosphate in the blood. These are the deficiency manifestation of vitamin D. So the 25-hydroxy vitamin D is the storage and circulatory form of vitamin D. When the level below 30 nanogram per milliliter, 30 nanogram per milliliter is known as insufficient vitamin D. When the level below 20 nanogram per milliliter, it is deficient. When the level is less than 10 nanogram per milliliter, severe deficiency. More than 150 nanogram per milliliter, it's said to be a toxic level. That normal range, many experts recommended 20 to 40 nanogram per milliliter. Other recommended 30 to 50 nanogram per milliliter. More than 150 means toxic. So other functions of vitamin D, it is helpful in the treatment of psoriasis because it has anti-proliferative action. It has immunomodulatory function. It is presented prevent coronary artery disease and useful in some cancer. This is all about vitamin D. Now notes format. Sources: RDA, biochemical function, 3 target tissues. Deficiency: rickets in children, osteomalacia for adult. The normal range. Thanks for watching.